Hello, everyone. My name is Kyle Longton, and I'm the Chief Operating Officer for the American Foreign Service Protective Association. And it is my pleasure and my honor to welcome you to our 2022 annual meeting, held once again virtually this year. When we began planning this meeting back in December, the Omicron variant was just starting to ramp up here in the DC area, and we erred on the side of caution and decided to go with an all virtual meeting once again this year. We appreciate you attending and joining us today and working with us as we continue to experience the new normal. And we do hope to see you again in person next year as circumstances allow. So I want to start out with a few housekeeping items before we get into the topics we promised to cover with today's meeting. First of all, one of the most frequent questions I anticipate we will get today is, will the session be recorded? And the answer to that is yes. We will be recording today's session. We will take some time to do some editing and optimizing, and we will share the recording, a link to it, within 2 weeks of today. And we will share that via email to the email address with which you registered for today's session. And as part of that, we also will have a special contest just for attendees of today's meeting. Once we post the annual meeting recording on our YouTube page, and that is where we'll send you the link that will direct you to the YouTube page. Please like it, comment on it, subscribe to our YouTube page, and we will select 6 winners for an AFSPA surprise pack, and we'll contact you and we will mail that surprise pack to you after that's happened. So please look for that. The detailed instructions with the deadline will be included with the post email that includes the recording, again, within the next 2 weeks. Now, for today's session, we will be taking questions. I want to thank those of you who submitted questions in advance. We have reached out to some of you to address some of those questions prior to today, and we also will have some time at the end of the entire program today to address some of those questions. But if you didn't submit something ahead of time, if something occurs to you during the talks today, please use the Q&A feature inside of Zoom to submit your questions. We will be monitoring those. We will be answering some of those in writing throughout the session, and I will save some of those to dialogue with Paula as well as with our keynote speaker during today's session. There is also a raise hand feature that you may see within Zoom. That is enabled. We don't have a way to turn that off, but we will not be monitoring that. We will not be taking any audio questions or turning on microphones or videos for any of today's attendees. So please use the Q&A feature. If you run into any of technical issues with Zoom today, I will encourage you to go to the Zoom website and look for troubleshooting tips there. If you have questions or want more information about any of the programs you hear about today, please visit our website at afspa.org. And you'll find all the information there, including forms and brochures. And please take a look at that. We will also include today a demo of our new website. If you haven't spent a lot of time on there, it is easier to use with optimized search to help you find what it is that you're looking for. And we will be aiming to keep today to about 2 hours, as promised. And I encourage you to stay to the end because we do have a special presentation that our outreach team has been working on for some weeks. I'm floored by it, so I look forward to sharing that with you, but it is a little bit of a surprise, so please stay to the end. You don't want to miss it. Now, if you've been receiving our emails or any mailings throughout this year so far, or even our fall newsletter last year, you'll know that our theme for 2022 is physical health leads to better mental wellness, a link to a better you. And we're very excited about this to talk about getting and remaining physically active and the effect that that can have not only on our physical health, but also on our mental wellness and well-being. Paula will talk more about this theme later today, and our keynote speaker will explore this in his talk today. I will say that just research has linked sitting for long periods of time with a number of health concerns. And I think a lot of us have been sitting more in the last 2 years than perhaps we were before. Some of these health concerns can include obesity, increased blood pressure, high blood sugar, excess body fat around the waist, and even abnormal cholesterol levels. That information comes from the Mayo Clinic based on a number of different studies that they have done. Some of the immediate benefits that you'll see once you undertake physical activity, on the effects on brain health happen right after a session of moderate to vigorous physical activity. And regular physical activity can help keep your thinking, learning, and judgment skills sharp as you age. The CDC tells us it can also reduce your risk of depression and anxiety and help you sleep better. And I don't know about you, but I could certainly use that last part in terms of sleeping better. In addition, being physically active has been shown to lower your risk for developing several commonly occurring cancers, including bladder, breast, colon, kidney, and lung. So please keep that in mind as we go throughout today. Share with us your questions, general, and if you have something more specific, we might handle that privately. But we welcome your questions. We welcome your input, experiences you might have with the programs that we're discussing today. But before we get to that, I would like to introduce briefly our chairman of the board of directors for AFSPA, Tom Tracy. Thomas M. Tracy serves as our chairman and has been in that role for more than a decade. Mr. Tracy joined the U.S. Foreign Service in 1960 and served in Mexico, New York, London, and Washington. He also served as the administrative officer at the American embassies in Brussels, Moscow, and Bonn. His extensive career led him to the position of Assistant Secretary for Administration, where he was responsible for the worldwide operations of diplomatic security, building operations, communications, and IT. Following his departure from the State Department, he went on to serve for 15 years as the Chief of Administration of the Pan American Health Organization, or PAHO. Following his retirement from PAHO in 1988, he worked as a contractor at the Department of State for a number of years. As our board chair, Mr. Tracy displays exceptional commitment, first-rate leadership, and personal integrity. He's earned the respect of his fellow board members to meet the challenges of leading the Protective Association. In addition to his decades serving on AFSPA's board, Mr. Tracy is also a member of the board, as well as the Secretary-Treasurer of the Senior Living Foundation of the American Foreign Service. I'm glad to share this message from Mr. Tracy with you now.
Good morning. I'm Tom Tracy, Chairman of the Board of the American Foreign Service Protective Association. On behalf of the directors, management, and staff of the Protective Association, I welcome you to the annual meeting. It's been 2 years since we've been able to meet in person. As the pandemic has spread, we've had to take measures to protect the staff and membership of the association. I very much hope that next year we'll be able to meet again in person and virtually. In the meantime, the staff is working from home to provide the level of services that you've come to expect. I can assure you that the association is in solid financial condition, even with the consolidation and complications that are arising in the healthcare field today. The board and the management of the association are working diligently to provide programs in order to meet the needs of the membership and a long-term plan to carry us into the future. I thank you for taking the time out of your schedule to meet with us today. We very much appreciate your input, and most of all, we appreciate the fact that you are loyal members of the association.
Thank you for that, Mr. Tracy. And he is absolutely correct that the staff is hard at work. We are also at work on a plan to begin returning staff to the office in the weeks and months ahead and begin a new hybrid work schedule, as I know many of our active duty members still serving in the government are as well. Now, as promised, we have a number of topics we are looking forward to covering today. We will review our activities throughout 2021. We'll also take a slightly deeper dive on COVID-19, and we'll also look ahead to the rest of this year on our 2022 initiatives, as well as those from OPM. We'll have a number of demonstrations of our online tools, both before and after the keynote presentation from Dr. Jonathan Rubens, who is the Chief Medical Officer for ActiveHealth. But before we get to any of that, and actually to walk us through all of that, we have our Chief Executive Officer and Executive Vice President, Paula Jacob. Paula Jacob, in her role as CEO and Executive Vice President, provides strategic leadership that facilitates the development and enhancement of various insurance and specialty programs offered by AFSPA, including the Foreign Service Benefit Plan. She also serves as the Executive Director of the Senior Living Foundation of the American Foreign Service. Mrs. Jacob has a 40-year extensive background in the insurance field and is formally recognized as a subject matter expert in federal health benefits by the Foreign Service Institute, where she serves on the adjunct faculty. She's also formally recognized as a registered health underwriter by the National Association of Health Underwriters. Paula, please take it away.
Thank you very much, Kyle, and it is such a pleasure to be with everybody today. We have missed you so much, and I'm sorry that we aren't able to see many of you in person. I so enjoy that, but hopefully you'll find that these virtual sessions is the next best thing, and you'll get some great information from it. So without further ado, I would like to talk about what happened last year during open season. Now, once again, we were not able to travel because of the COVID virus, but we were able still to hopefully meet members where they were. We actually were able to attend 3 in-person sessions in the DC area, but we also hosted 15 live events to accommodate more than 200 of our members. We participated in several virtual health fairs, and we also participated in a multi-carrier virtual fair that housed over 450 attendees. We were able to hold presentations for the Department of State, for the Board of Directors of the Federal Education Association, and in partnership with both AFSA and DACOR. And we are so grateful for the partners who share our passion in getting the information to their members and our members that will help benefit in their decision for the following year. Next slide, please. So a little bit about what happened to us during open season. We actually processed over 3,100 transactions. Our eligibility department was extremely busy this year. We were able to welcome over 1,700 new enrollees. So for those of you who are new to us, welcome to our family. And we hope that you will receive the service and benefits that you were promised. We had a total enrollment now of over 37,000 members, and we are actually responsible for over 92,000 healthcare lives. So we take that responsibility very, very seriously. Next slide. So some of the operational statistics that I would like to share with you today are as follows. We actually paid over $466 million in claims last year. And that resulted in over 1.5 million claims. Now, 70% of those were actually filled electronically. So thank you for using your portal and sending those claims to us electronically. It's faster for you and it's faster for us. Our operational results has done a very good job of administering the claims processing function of the plan. They work at an almost 99.98% claim processing accuracy. Almost 96% of those claims were in fact processed within 15 calendar days, and 88.7% of the overseas claims were processed within those 15 calendar days. And that includes those translations that are required. So clearly they work very, very hard to receive your claims and to get those claims processed as soon as possible. Next slide. As far as member service goes, no matter where we physically are, whether it is in the office or our HBOs at home, we take service to you very, very seriously. We handled over 100,000 member calls last year. This was a 50% increase over 2020. So our representatives were very, very busy assisting you in your questions and concerns. Still, our average speed of answer for last year was 25 seconds. And the emails that were answered within 3 business days. So we continue to strive each and every day to provide the excellent service that you as our members have come to expect from us. Now, COVID-19 does continue to provide ongoing challenges for us as we continue to serve our members through telework. Kyle did mention that we are working on a hybrid method so that we can be back in the office in any given day, because we do love to welcome our members who visit us occasionally at our headquarters. But we do remain very passionate about member services here at AFSPA. Next slide. So let's talk about more numbers. Prescription drugs, this is a huge benefit, and it's very, very seriously. The plan processed over 1 million prescriptions last year, and we paid about almost 90% of those prescription copays. So we're very, very pleased with that record. Now, a lot of them were by mail, so I'm very glad to see that for those maintenance drugs that you are receiving them by mail and ordering them by mail. It is faster, I think, and it's also more financially effective for you to get your prescriptions through the 90-day mail order program. Next. Now let's talk about COVID and the effect that COVID has had for the Foreign Service Benefit Plan and for our members. We had a cumulative testing that was tested positive of over 4,000 members. And unfortunately and sadly, 47 of our members succumbed to the COVID-19 virus. Our total spend for related claims last year was actually over $23 million in just COVID-related claims, which is sad, but we are very, very glad that we are able to be here for our members as we all have to deal with COVID-19, and the aftermath. I don't think that COVID is done with us yet. And like Kyle said, we do have to get to our new normal. Next slide. Let's talk about testing, because testing has been in the news a lot since the beginning, actually. So I want to review what the Foreign Service Benefit Plan handles testing. So in an in-network setting, in a clinical in-network setting, the Foreign Service Benefit Plan your testing is covered at 100%, and that is filed directly by your provider. The out-of-network and overseas claims are covered at 100%, but the member, especially overseas, may have to pay ahead of time and then file for reimbursement. Now, as far as the over-the-counter test goes, they are available actually at the network pharmacies through Express Scripts, and this is available at the pharmacy counter. And the pharmacy itself will bill us directly, so you don't have to worry about that. AFSPA, the plan will pay 100% of those bill charges that are billed by a pharmacy that is in network with us. For other over-the-counter testing in the United States, if you purchase an FDA-approved test, you will have to file a claim and be reimbursed by us up to $12 per test in accordance with the new government regulations. And this actually does include, I do want to remind folks that this does include tests that you purchase at, even if it is a retail pharmacy like CVS or Walgreens or whatever, if you purchase that at the regular checkout counter and not at the pharmacy counter, you will have to file your claim and you'll be reimbursed up to $12 per test. For overseas, of course, that's not available to you. So all approved tests are reimbursed at the full cost of the test. Regardless of the source that you get your over-the-counter test, we will cover a maximum of 8 tests for each member that is covered under the plan for every rolling 30 days. Next slide. I'd like to spend a few minutes to talk about the impact of COVID on the healthcare industry and the FEHB in particular, and for us in particular. So 2020 was the beginning, and it was a really, really tough year. And we paid a lot for the cost of testing. That happened a lot for the plans. And there was a lot of delayed care that happened in 2020 because people were afraid to get out of the house, and they were afraid to go to the doctors. New technologies, of course, still continued, and that was not related to COVID, but COVID certainly impacted that. Moving on to 2021, though, however, last year we continue to pay for that cost for testing, and people started venturing out of their house. Immunizations, because of the new vaccine that came out, they were up 97%, and usage of mini clinics was up by 312%, which is really a good thing because you were able to use those mini clinics for several reasons, not just for vaccines and testing, but for other acute conditions that they were able to treat for. And that helped in the fact that you didn't have to go to the emergency room on those issues that you could be handled by a mini clinic. And then we dealt with the results of that delayed care from 2020. As more and more people ventured out and started getting their health care, we saw an increase in cancer cases they were up by 11%, and including the specialty drugs for cancers were up by 32%. And what we were seeing in 2021 is when they did get a diagnosis of cancer, it was very often not just stage 1 and stage 2, but quite often, unfortunately, stage 3 and 4 because of the delay. Ambulatory care was up by 25%. And as more and more people decided to go ahead and get those endoscopies and colonoscopies and the knee replacements and things like that, surgery was up by 26% last year. And then we dealt with new issues that I thought was directly related to telework, such as all of those musculoskeletal problems from sitting in front of our laptops every single day and not being able to walk around or exercise like Kyle was talking about. So issues with musculoskeletal problems like neck pain and shoulder pain and back pain really increased. As a matter of fact, a good 30% of our members complained about musculoskeletal problems. So we were very, very happy when we were able to offer Hinge Health, which is the digital exercise program for our stateside people. And then specialty prescriptions were also up as people were getting care they needed and treatment they needed. But understand that, yes, specialty prescriptions were in fact up, and the average cost of just one of those specialty prescriptions, average cost was about $20,000. So we did see an increase in what we call trend or usage for across the board in several areas for 2021. Mental health continued to be a major issue and a major concern for all of us during the COVID pandemic, and I think it will continue. The issue was there before COVID, but I actually think, and it has shown to be true, is that COVID actually exacerbated the issue by isolation and concern and just everything that was going on in people's lives. And it affected all age groups. We are especially concerned about how this has affected the mental wellness of our kids and teens. So we actually have special programs out there for them. Next slide. Telehealth was a lifesaver for us, and it will continue to be. I think it is the new normal as far as treatment goes. And we were really able to meet members where they were at any given time through both our telemedicine program and our telehealth programs. But as you can see by the chart, the pie chart on the right, when I say that behavioral health and mental wellness was a major concern, you can see that the majority, about 60% of people who use telemedicine and telehealth was for mental health and behavioral health services. So let's talk about telemedicine, which is the visits that we cover if you have an established physician or provider and you have a telehealth visit with them. This is available worldwide now. You actually can see your physician or a provider that you have established a relationship with, whether it be here or wherever, and we will pay the same as you were going into that provider's office. Now, stateside, we have two ways. We have the telehealth provides for teledoc stateside for your general health needs, your mental health, dermatology, and even working with a registered dietitian. For overseas, last year, we were able to implement VHealth for our overseas members, which is the overseas telehealth option. And this actually provided services for general health and, as important, if not more important, the mental health of our members overseas. And this was a widely popular program offered, and people did really take advantage of those services. So we were glad to be able to support you in that way. Next slide. To the point of over $22 million last year was provided for telehealth and telemedicine claims. Over 20,000 of our members use this service at any given period of time during the year. That was this is not a typo, a 3,200% increase from 2019 to 2020, and even a 15% increase from 2020 to 2021, as people got more comfortable with the video calls and the telehealth phone calls. So I think that telemedicine and telehealth is here to stay. Behavioral health continues to be the leading reason that brings members to those telemedicine services. Next slide. As always, our goal is to bring healthcare closer. COVID didn't necessarily change the way healthcare is being delivered. We were working on this for many, many years before, but it certainly accelerated plans putting these programs in place. For example, like the telehealth and telemedicine program. But beyond that, we're talking about in-home programs, like the virtual exercise and physical therapy program that we offer. And in some cases, especially when it was very unsafe or so unsafe to go outside for our cancer patients, we were able to, in many cases, provide nurses to come in to provide those very, very important life-saving infusions for them right in their own home, which was really a lifesaver for many of them. We always and have continued to explore new smart healthcare devices and how they can be used by our members and for the appropriate cases and conditions. And also we continue our wellness tools to make sure that we are providing those tools and programs to you to help you in your health and wellness journey. Next slide. As always, our focus is always the personal support, not as you as a number, but you as a patient and you as a member. Our goal is always to provide innovation with the right support programs at the right time that is specifically tailored to you as an individual patient. And we do that in many, many ways. Next slide. Our care management program through Aetna really gives you the ability to talk to a nurse that is assigned to you, who will remain with you for as long as you need. This is one-on-one continuous support. And that nurse can answer questions about doctor's orders, about how you're feeling, about different symptoms, different side effects maybe. So you have somebody you can call and get those questions answered maybe before they become a real concern. That's their goal. We also have certain programs that might be available that you might find helpful, like our social work program, where you can they actually can connect you with local resources for things like home delivered meals or even support groups that you might find helpful to you. Our compassionate care program is one that is geared to support you when you're facing advanced illness or imminent end of life decision. This is really different than the hospice care program. It is really a good friend, if you will, to help you through advanced planning. And then, of course, our pain management program is there to really support you when you are facing chronic pain and even opioid dependency or trying to avoid opioids altogether. That's what our pain management program is there for you to help you through. And we do really try to explore other treatment modalities other than pharmacy, whether it be certain exercise programs or additional physical therapy benefits or things like that. So if you're in that situation, please call us and feel free to use all of these programs that are in fact available to you at no cost. Next slide. And I'm very, very excited to talk about our lifestyle and condition coaching program. This is new, it's expanded over the last several years. And I don't want to steal too much of Dr. Rubens' thunder because I know he's excited about talking about this too. So I will try to hold back on my enthusiasm. But we finally found a way to use a holistic approach to help you achieve your best health in a variety of areas. And this has really expanded and grown and matured over the years. So while now we can help you with just general health or weight management, even when it comes to pediatrics. Stress management is always an issue, as well as pain management. But we also dig deeper, and we're able to really help you through serious chronic conditions and coach you through that to make you able to live your life to the fullest, even with these conditions like coronary artery disease or high blood pressure, or maybe you have asthma, even pediatrics with asthma, or COPD. These are serious conditions, but that doesn't mean that you can't live life to the fullest. And our coaches are there to help you through that and to give you advice and support. You please use us to help you reach your goals in not just a couple of conditions that we started with back, probably 5 years ago, or even more when we started these coaching programs, but now they have expanded to over 40 conditions. And with that, I will hold back because I see that Dr. Rubin is there and he's probably telling me to stop now because I'm stealing his thunder. So we will move on. Next slide. So our theme for the next couple of years is, as we continue our focus on mental wellness, of course, to help you carry that load, as we have said in the past. We really want to help you focus on physical health that will lead to a better better mental wellness. And our focus is to try to link those two together to really help you become a better you, whether it is through our member engagement platform, digital support programs, the importance and help you with the quality of nutrition and sleep and exercise. Improve your overall health is our goal. And there are so many opportunities that you can take advantage of now to help you through that. And again, Dr. Rubin, I'll hold back and let you talk about the ways that linking the two, the physical health to the mental health, can provide that benefit and scenario. Next slide. And of course, we're willing to pay you for it. Our Simple Steps to Living Well Together program continues to expand and grow as your needs change. You can earn wellness incentive cash that will go into your wellness incentive accounts for a variety of things, like getting your health risk assessment or getting your screenings, cancer, your cervical cancer screening, breast cancer screening, getting your COVID-19 vaccine. This year, we've even added help in tracking your physical activity, that you can actually earn those incentive rewards. So we provide a lot of different ways and a lot of different rewards, up to a maximum of actually $400, which is actually more than our in-network deductible. So think about that. You can wipe out your deductible by doing some of these things that will help you in your health journey. It's a win-win situation. Next slide. And as I end and Dr. Rubin takes over and we are also able to see some of the demonstrations, I do want to remind you of a few things. In January of 2022, the No Surprises Act took force, and this actually protects you at hospitals and in emergencies. We had talked about this. It is in our fall newsletter, and I do want to remind you that this does protect you when you are receiving care at an in-network hospital and you may be receiving care from an out-of-network provider. But I want you to be aware, though, that it does not cover all providers. For example, it may not cover certain retail clinics that like drugstores. Now, of course, if you go to CVS, they are an in-network provider, of course, and they have over 1,100 mini clinics that are or health hubs that are available to you. But certain urgent care clinics that you might go to may or may not be covered under this No Surprises Act. So it's always important to really look at that as well. I do want to remind you that massage therapy claims also do not require a CPT code, but there are special filing requirements for those massage therapy claims. And some of you are looking up now. I think you probably woke up a bit saying, what do you mean massage therapy? Yes, the Foreign Service Benefit Plan does provide for massage therapy benefits. So if you haven't already, you may want to look that up. For those of you who have Medicare and go to a chiropractor, your chiropractor claims must go through Medicare first, because Medicare does have limited benefits for chiropractic care. And before this plan can pay, we need to know what Medicare paid. A couple of reminders also is that if you have not already signed up for it, you may want to consider signing up for electronic funds transfer, so that your claims reimbursement can be sent right directly to your bank account. You will get your money faster that way. So we've made it easier for you. It is a fillable PDF form now, and you can get it off of our website. Every time I talk, I also want to remind people about the HIPAA 3 form, which is the privacy form that is required for us to be able to talk to any family member that you want us to talk to. If we do not have that form on file, we are not allowed to release any information about you to anybody, even your spouse. So it does allow us to discuss your claim or to release your PHI to a family member. And also, if you received a member satisfaction and an experience survey from OPM, it may have come from us, but please, we do encourage you and ask you to complete those forms and return that survey. It helps OPM, and it definitely helps us to be a better plan for you. So these are just a few of the reminders that I wanted to get through to you before the next slide. Just a quick reminder about our other ancillary programs. We did just add a critical illness program. You may want to check that out, but remind you that we also have several life plans, several dental plans that you may want to review. They are in competition with the Federal Employees Dental and Vision Insurance Program, but they may be a little more flexible for you. We do have different plans as far as members of households for those people who you take overseas with you, who are not allowed to be on your FEHB health plan. We have tons of different services as far as retirement and financial planning, and I won't spend any more time on that, but I also want to remind you about our discount programs. Drew, please. Just briefly, those 3 very, very important discount care programs that we have for our members stateside, the dental and vision care, that if you do not want to purchase a fully insured plan, these may work for you because it is not an insurance plan. It is a discount program. And also that extremely popular hearing aid program through True Hearing that many of our members have used and have been able to save a ton of money on their hearing aids. So if you're interested in that, please visit afspa.org -discount or /discount care for full details about those programs. Next slide. And one last thing, I do want to talk a little bit about the Senior Living Foundation, which, as you know, is the charitable arm to support the Foreign Service colleagues who actually encounter challenges that come with aging. We provide, our resource center provides guidance and support to help you through that maze. Our grants support care management, medical and prescription needs, durable medical equipment when needed, and just basic living expenses, because things change, can change in a blink of an eye in many cases, and the foundation is there to support you. Our very, very popular parent program actually now provides guidance and help to active duty families, personnel who are managing their parents' care from overseas. Primarily, I mean, you've all been there, so imagine that. Last year, we received almost $1 million, $980,000, thanks to 2 very substantial bequests and a couple of very, very generous donors over last year. For anybody who donated, who gave, who believes in our mission, you know who you are. I want to personally thank you. And also on the behalf of the Senior Living Foundation Board, thank you for believing in our mission and supporting our mission. Through your support, we were able to give over $600,000 in grants just last year. To learn more about this foundation activities, please go to slfoundation.org and you'll see what we do, how we do it, and how we do follow our mission of taking care of our own. Next slide. Couple more things about Medicare, just Medicare briefly. No, I'm not going to give my 45-minute talk on Medicare. There hasn't been a lot of big changes in Medicare for 2020. It remains a very personal decision for you. Just make sure that you know all of the facts. You know what the circumstances are and what the consequences are. Make sure you talk to your favorite physicians about that, because it is very important that if you have a favorite physician that does not take Medicare, you know that ahead of time. A couple of things about the new, you may have heard about this, Medicare Advantage plans. They are in fact increasing in popularity, and actually the FEHB program, many of the plans are looking at this. They're federal Medicare Advantage plans. Many of them are offering this. Before you ask, yes, we are considering an option in this to provide for our members who want it in 2023. Much more to come on that. And there is a whole focus. We have a whole focus on Medicare series that are available to you, where I go in depth of the Medicare program and how it works with the FEHB and specifically the Foreign Service Benefit Plan. There is also a podcast that we have developed for our TRICARE members out there that you may be interested in, how Medicare for Life and the FEHB and Medicare, or I'm sorry, TRICARE for Life and Medicare and the FEHB work together. You can find that podcast. And we also have a new podcast that we just worked on that really is an introduction to these federal Medicare Advantage plans. So there's a lot more to come on that, and you'll be hearing from us about that soon. Next slide. Again, we simply want to be partners in your health, and We want to provide you with as much support as you want and you can accept from us, because I know that sometimes it's kind of overwhelming. You get a lot of information from us. Excuse me. You get a lot of information from us, but our whole goal is to make sure that you have almost a menu of things that you can use. So every individual is different, and our goal is to make sure that you have the right programs to fit your specific needs. Next slide. And with that, once again, I want to thank you for, I know that Mr. Tracy thanked you, and I know Kyle thanked you. So it's my turn to thank you for being loyal members to the association and to the Foreign Service Benefit Plan. And with that, I'll turn it over to Kyle.
Paula, thank you very much for walking us through the successes, even in light of the challenges we had in 2021, as well as the programs we've been able to add. I did want to make one note. If you are someone who thinks that you want to sign up for the electronic funds transfer, the EFT reimbursement, but you've been hesitant because you don't want to fill out the form and fax it or mail it or anything like that, we have actually, as part of our new website, added a secure form in the website where you can just input the information in there. You don't have to deal with a PDF or anything like that. It's directly on a secure form on the website. So that is a great feature we have, and it's just one of the features of our new website. So if you haven't spent a lot of time on our website in the last, let's say, 4 months, you may not be familiar with these. We launched a new website in November, and I am thrilled by it. I am thrilled that I am still finding new features on it every day. The search has improved, the layout has improved, the ease of accessing information, not only on the desktop, but in particular in the mobile setting has improved. And so our communications supervisor, Michelle Pangilinan, has put together a video to demonstrate some of the new features and show you how to take best advantage of the website. And she will do it much better than I can. So I will just ask if we can go ahead and show the video from Michelle.
Welcome to the newly redesigned AFSPA website. Let me begin by going over some of the newer features, including our sticky header and menu. If you're looking for the home button, the AFSPA logo serves as the home button. As you're navigating the different parts of the site and you want to go back to the home page, just click on the AFSPA logo and it will take you back to the home page. Since the menu is the most used feature to navigate any website, we made our menu more comprehensive to make it easier to get the information you need. The first section of our menu is the Plans section. Here you will find all the information on the coverage and benefits offered by each plan, whether it's the Foreign Service Benefit Plan, which is our health insurance, or one of the ancillary insurance programs like dental, disability, critical illness, and more. The headers under the plan sections are clickable and leads to a separate landing page for each program. Since a high percentage of our members are enrolled in the Foreign Service Benefit Plan, the menu offers a subsection of quick links to help you get to the plan information faster. One of the newest features we've added is our Forms and Brochures page, which serves as a one-stop shop library of all the plan forms and brochures you need. To help us meet your special non-medical and non-insurance needs, we have created a network of professional partnerships from legal and tax consulting to financial and retirement planning. These savvy, trusted experts are ready to meet with you when you need them. Our Member Resources section is a new section we hope you will find most useful. You have access to the 3 main online portals used to access your coverage, benefits, and plan information: the AFSPA Member Portal, the Aetna Member Secure website, and the Express Scripts site. Just a friendly reminder, the AFSPA Member Portal offers a single sign-on feature that will allow you to access all 3 portals in one place. You can learn more about that in a separate demo video, and I will provide a link below. Our Stay Connected section of the menu is another new feature that we hope you find useful. Here you will find links to our news page to find out about the latest in AFSPA news and information related to our plans and services. Our newsletter page holds the archives of the interactive digital versions of our AFSPA in Action newsletters. Our blog page gives you information about overall health and wellness, as well as member benefits and more. Our podcast page houses all of our AFSPA Talks podcast episodes hosted by AFSPA COO Kyle Longton. If you haven't already, we encourage you to subscribe to our podcast, AFSPA Talks, wherever you get your podcasts. In this section, you have access to our AFSPA CEO monthly message archives and important prescription alert. Our events section on the menu allows you to immediately see any upcoming events and webinars. Simply click on the Register for an Event header to see our entire list of events. Our Contact Us page is new and improved. All the information you need to get in touch with us will be on this page, including our secure forms. We separated the sections by member and providers. If you would like to send us a secure message, click on the tab to find the appropriate form to send us a secure message. Lastly, one of the newest features on our site includes a new navigation pathway to help guide you in finding what you're looking for. You can find this on our homepage. Now, for example, let's say I'm an existing member of the Foreign Service Benefit Plan and I would like to see a chart summary of my coverage and benefits. When I click here, it takes me directly to the section of the page showing the chart that I am looking for. We hope you found this short video overview of our newly redesigned website helpful. The main goal of redesigning our website is to deliver a better, cleaner, more responsive, and faster user experience, making it easy for you to find the information you need when visiting our website. Our efforts to improve the website is ongoing, so we welcome your valuable feedback. If you have a moment, click the link at the footer of our homepage to tell us what you think and how we can improve. Thanks for watching.
Thank you very much, Michelle, for that overview. And without much further ado, Michelle did reference our new member portal, and our IT director, newly promoted, Yancey Mueller, has put together a demo of that feature. And I think a lot of you will find that this is a fantastic improvement. So without any further ado, I'll ask that we go ahead and view Yancey's demo.
Everyone, I'm Nancy Mueller, the Information Technology Manager here at AFSPA. Today I'll be conducting the demo for our new user-friendly mobile enhanced member portal. This site is something that we've been working on for the last year. As some of you may already know, we are in the final stages and would like to invite each and every one of you to start using this website as early as today. This site has not yet been published to other users besides the volunteers who've helped with testing so far, but we hope that with your participation, we can be a step closer to announcing the website launch to the rest of the AFSPA members. Without further ado, let's get started. As you can see, I'm already sharing my screen from my mobile device. And the website or URL that you want to go to in order to access the mobile enhanced member portal is https://afspamembers.afspa.org. This site can be accessed via mobile device, tablet, or regular PC. Though the advantage with accessing the site via mobile device or tablet is that now you can start taking pictures of the claim. I know in the past, some of you had expressed the desire to be able to simply take pictures of your claims and have those images processed. But now this is something that we are capable of doing. So we hope that you're able to take advantage of the new features. So as you can see, I'm already on the landing page and the system is already prompting for username and password. And I'm going to use the very same credentials that I use on the old site. So whichever credentials you've established for Member Portal is what you want to use here. All right, and as you can see, the very first thing that is displayed to me is the menu options at the very top. for claims, incentives, messages for the Aetna, future Aetna SSO link that we're still finalizing and we'll have available here in the next few weeks. There's also plan information. You'll have the policy date, term date if applicable, type of coverage, plan type, payroll office, and then any dependents that may also be enrolled in the plan with you. Below that, you have the forms section where you can go in to submit a claim, submit an incentive, request 1095-B form, send in questions regarding benefits or claims, submit your electronic funds transfer form, or you can send information regarding your enrollment update, any marriage certificates, ID cards, etc. And then right below this, you'll see that we have any other plan information that's also listed. In this case, my test account has an IVP enrollment, immediate benefit plan. It's not enrolled into a disability plan at the moment, but it is enrolled into a dental plan. There's no SLF donations at the moment. So the menu option that we refer to as a burger is on the right upper hand side. And as you can see, some of the menu options that are already displayed on the homepage are also accessible through here. You have the news section, you have plans, messages, claims, incentives, payments, which is a section that we're working on, profile, SLF, and the option to log out. In this case, I will go ahead and demonstrate the process of uploading a claim. So I'm going to click on claims. And as you can see, there's already claims data here. So every claim that you have uploaded to the member portal will also be displayed here. So to submit a new claim, I'm going to click on new claim on the right upper hand side. And I have the typical options here where I can go in to select the claim type, whether it's a claim without questions, claim with questions, claim directed to a specific HPO if you happen to be working with an HPO, or if you're submitting a claim for a COVID-19 over-the-counter testing kit. In this case, I will go ahead and submit a claim without questions. Select the member that it's for. In this case, I'll leave it as a primary subscriber. As far as the plan year, I have the option to select the current plan year or previous plan year. I'll leave it as the current plan year. And the diagnosis or reason for visit for me will be a test. Now, in here, the next option is to use the camera to capture documents to upload a form, which is the option that I will choose. So I click there. There's, as you can see, several options here. So photo library would be if you've already taken a picture of your claim, it's already saved on your device, and you want to go simply into the library and choose the option or choose the image that you wish to utilize. In my case, I will go ahead and select take photo. And as you can see, I already have a test page here ready to go. So I'm going to make sure that the file itself is legible. I'm going to click on photo, and I'm going to choose use photo. Now that I've picked that option, as you can see on the preview, that image is displayed. I'm going to certify that the information in this claim submission is complete and accurate. Scroll up, make sure that I filled every field here. Everything looks good, and I'm going to click on submit. You can see the system is now processing my image, converting it to a secure PDF, attaching the cover sheet, and making sure that it's logged in the claims section. So I'm going to click over to claims. And as you can see, there's a claim submission for today's date. I'm going to click on download. And download one more time. And as you can see on the right upper hand side, this is an Apple device, but on the right upper hand side, there's that little circle with the arrow pointing down. That shows me the downloaded files that I have. So I'm going to click on the file. Now I can see here that the claims cover page has been attached. It's showing the claim service year, who the claim is submitted for, diagnosis or the reason for visit, as well as the image or the picture that I've taken with the device. I'm going to click on done. I know that everything is good to go here. The other menu options that are available within this new mobile enhanced portal is the news section. As you can see, there's already information that's pulled in from the website. And so this is another enhancement that we process to make sure that we are able to get information out to our members as quickly as possible. So whatever information we post on the news section on the AFSPA.org site also gets posted on this section of the mobile enhanced site. Once again, you have the plan information for any other plans that you're currently enrolled into. You have the messages section, so if there's any secure messages that you've sent through the same email that is registered for the member portal, you'll be able to see that information here. And you can send your replies securely through this section. As you can see, I've already sent a test reply under this EFT form. My incentive section. Any incentives that you've already submitted will be displayed here. And it's essentially the same process. You go into new incentive, fill in the required fields, choose to upload a file or take a brand new picture, click on submit, and that file will be processed and ready for you to view. The payments option, again, this is a new feature, but we've allocated the space here. Profile section is where you can go in and make changes to your address. You can go ahead and update your contact information, phone number, email, and then you can also update your communication preferences where you choose to receive email information from us, whether you choose to receive mail information or mailed in information, or if you choose to opt out of those communications. And this is essentially the brand new mobile enhanced site. It looks exactly the same on the computer on the PC. It's just that the menu options are laid out differently at the very top versus having to use what we call the burger. But I will show you what this page looks like really quickly on a desktop computer. I have the main login page. And again, here's the very same menu options. Plan information, dependent information, forms information. And one thing that I just realized I forgot to mention is the plan documentation, where you can access your benefit brochure, your prescription benefit handbook, member rights and responsibilities, notice of privacy practices. And here at the very top is where you have the different menu options. Again, instead of having the little burger on the right upper hand side, you have all the menu options right across the screen. And that concludes my live demo of the new mobile enhanced site. I hope that you will take the time to start navigating the site and let us know what your experience is like. Thank you very much and have a wonderful day.
Great. Yancey, thank you very much. That was fantastic. And I just want to share with everybody here a little bit of information about the new site. It is still in a development and somewhat of a testing phase. So as Yancey said, we are looking forward to you all starting to utilize this site. What I can tell you is that the new mobile enhanced version of the AFSPA Member Portal is available for your use. We strongly encourage members to use a mobile or tablet device rather than a desktop computer for the best experience on this new platform at this time. The enhancements to the desktop version of the Member Portal are coming soon. It's just not optimized for desktop just yet. But in the meantime, feel free to use either version of the mobile or the desktop for your AFSPA and your FSBP needs. We will, after today's session, be sending out a separate email to the email address you used to register for today's event. And that will include the link that Yancey shared at the beginning of the video that will allow you access to this new platform. And again, we recommend using that new link on your tablet or on your mobile device. Either are available, though. More information to come. Now, speaking of more information to come, we have been promising a fantastic keynote talk, and I know that our speaker today can deliver on that. If you are a subscriber to our podcast, you may already be familiar with our keynote speaker, Jonathan S. Rubens. He is the Chief Medical Officer of ActiveHealth Management. He brings more than 25 years of experience as a physician leader in both academic and community settings. As the Chief Medical Officer, Jonathan leads a multidisciplinary team of physicians, pharmacists, and nurses focused on building effective population health management programs and clinical analytic tools to promote evidence-based patient care. Jonathan is board certified in emergency medicine and a fellow of the American College of Emergency Physicians and American Academy of Emergency Medicine. I've been looking forward to the talk today, a follow-up, as I said, on a podcast we did back in December. So without any further ado, Dr. Rubens, please share with us your thoughts.
Thanks, Kyle, and thanks to your team for inviting me to spend a few minutes with you all today. I'm excited about the chance to talk to you a little bit about your theme for 2022, Physical Health Leads to Better Mental Well-Being. So let's dive in. I thought we might start at the beginning here with a quote. which is really reminds me that it's crucial that we understand and acknowledge the connection of our physical well-being to our mental well-being. And Drew, you can advance to the next slide. So over the next few minutes, I really hope you'll come to know this as one thing, not your physical well-being or your mental well-being, but well-being in the whole person sense, because we at ActiveHealth really believe in whole person health. And it's important that we understand this connection between all parts of ourselves and how that contributes to our sense of well-being. And I'm going to introduce you to a resource that you now have that Kyle spoke about that supports this connection and that can support you in achieving your best health. So to the next slide, we only have to look as far back as the last 2 years, right, to have the real striking evidence of the mind-body connection, right? The COVID pandemic really brought this into stark focus for many of us. So, the increase in anxiety and depression symptoms almost quadrupled in the 2-year period. A third of us aren't getting enough sleep. Most people aren't eating well. There's been an increase in substance abuse, alcohol, and illicit drugs. And most people with chronic conditions have said that they had some worsening of those symptoms or more difficulty managing, whether that's because of difficulty getting to the providers, difficulty managing their medications, or handling the other things that interact with those chronic conditions. So on the next slide, we talk a little bit about how these physical health pieces contribute to your mental well-being. So this essential connection is really something that we in medicine have known for a long time, right? But we have artificially, and I'll raise my hand and say guilty as charged, made this artificial distinction between psychiatry and medicine, or mental health and physical health. And we really now it's clear to all of us that we have to get rid of that artificial distinction and bring this back to the whole. Research evidence really consistently demonstrates for us that people with long-term health conditions are 2 to 3 times more likely to experience mental health problems than the general population. And much of that evidence really relates specifically to what we call affective disorders, or things such as depression or anxiety. Although comorbidities are also common in things like people with dementia or cognitive decline. And for those of you who are taking care of elderly family members, you know that they often accompany other chronic conditions they may be managing. There is in particular very strong evidence for a close association with chronic conditions that you're very familiar with, and some of us may be suffering from: cardiovascular diseases, whether that's coronary disease or cerebrovascular disease like stroke or hypertension or atherosclerosis, diabetes, chronic lung diseases like asthma and COPD, and even musculoskeletal disorders like chronic neck and back pain contribute to this feeling. And in those patients who have those chronic conditions, depression is known to be 2 to 3 times more common. And after a heart failure episode or after a heart attack, it could be even as high as 50%. People with diabetes, 2 to 3 times more likely to have depression, and anxiety is also common. And in people with COPD, mental ill health is 3 times more common than in the general population. For people with chronic pain, think about this: a third of women and 20% of men with all types of arthritis, be that rheumatoid arthritis, osteoarthritis, may also have depression as a comorbid condition. And there's clearly evidence for higher than usual levels of mental health problems in people with cancer and chronic conditions like HIV/AIDS. So overall, it's really likely that 30%, 1/3 of us with a long-term condition also have some evidence of a mental health problem. So we have to normalize that, we have to destigmatize that, and we have to make it clear that this is part of treating the whole person. Now, how this happens and what the underlying relationship is very complex, but it suggests that it is a combination of things that are biological, psychological, social, environmental. We know that loneliness plays a big role in this these days, as well as behavioral factors. But it's also very important to note that this is a two-way street, right? The physical can result in mental health issues. The mental health issues can result in worsening physical conditions, because there's strong evidence that mental health problems like depression or anxiety increases the risk of onset of some physical illness conditions. So the connection is real, it's there, and we have to stop artificially separating it. We have to think of people as they're holding the whole self, if you will. Which brings me to the next slide. I'm going to talk a little bit to you about whole person health. So at ActiveHealth, we really believe in whole person health. And what that means, it means helping people, individuals, their families, the communities they live in, and the populations that we serve improve their health in ways that are interconnected. So making the connection between that biological, behavioral, social, and environmental. Health and well-being is going to happen to all of us in the context of the lives that we're living, right? It's not an abstract concept. Your diabetes, your asthma exacerbation, or weight management problem isn't happening outside of all the other things going on in your life. And that includes what we call spirit. And we say that not necessarily in any specific religious sense, although it could be at the individual level, but really more so in a sense of self-awareness, a feeling of self-actualization, if you will. What's the state of being that enables all of us to see ourselves succeeding every day, or to believe that we can have better health, we can better control our diabetes, or we can have more exercise tolerance, or we can lose that weight, and that well-being is really possible for us. What is the force that you tap into every day that says, I can get up, I can do this, I can be successful? That's the sense of spirit that we're really talking about here. And as your partners in well-being, ActiveHealth really strives to understand the life you're leading as much in context as possible, because we know that it's key to helping everyone that we work with achieve their best health. Instead of focusing on that one condition, we focus on the whole person, focus on restoring health, maintaining health, promoting resilience, and preventing diseases across an entire lifespan. So when we talk about whole person health, this is really what we mean. It is the physical, it is the mental, and it is also the sense of spirit, the sense of well-being. And the next slide talks a little bit about how we can do that. So the really good news for you all is that none of us really have to face any of this by ourselves, right? That's another lesson we learned from the pandemic, is we're not alone. We're all going through this together, and there is help and support out there. New to you this year is ActiveHealth's full lifestyle and condition coaching program. And our lifestyle and condition coaching program can help with a number of conditions, as well as lifestyle focus areas that you might want to work on. So some of the most common conditions we help people work with are things like high blood pressure or high cholesterol, or diabetes, metabolic syndrome, which is sometimes called prediabetes, or chronic pain or respiratory illnesses. But it could even be that there's not a specific health condition that you may have or that you want to work on, but a behavior you want to change. Maybe you want to get more sleep. Maybe you want to do stress reduction. Maybe you want to learn to meditate. We have coaches that can talk you through all of those things as well. Our coaches can support you through weight loss goals, help you develop the healthy behaviors and specialized support that you need, can even help people stop smoking. So it's a wide range of things that can fit almost sort of any part of the condition that you might be experiencing. As an added benefit, you have chosen to provide incentives for many of these activities, right? So not only do things for your health and for the community and the people that are in your life, but you get a benefit from it. And I know Paul spoke about that earlier. So why do coaching? Well, at some point, we've all been sitting in a doctor's office or had a provider say to us, you should do this or you should do that because it will make you healthier. And we all have sat there and said, yeah, okay, and then either dropped the ball or couldn't figure out how to get started or couldn't make it work in the rest of our lives, whether that's getting exercise and stopping smoking or losing weight or not eating things you shouldn't eat. So, telling you what to do and saying you should do something was enough. We'd all have solved this by now. Obviously, it's not. So, knowing what needs to be done and doing it, two completely different things. So let's say what happens after you leave that doctor's office, right? You're mulling over the comments and you're like, well, I'm ready to do something, but you don't know where to start. That's when you call us. The lifestyle and condition coaching staff and the coaches is your place to begin. The coaches can join you on this journey to better health. They're all clinicians. They're registered nurses, exercise physiologists, registered dietitians, social workers, tobacco cessation specialists, all that have multiple certifications in their respective fields. And these folks can become your trusted guides and mentors along your journey to the lifestyle change you're trying to make. And just like a coach, they listen to you, they learn what motivates you, where your strengths and weaknesses are, and most importantly, work with you as opposed to sort of just imposing things on you to develop goals and create the action steps that'll get you where you want to go. So how do you take advantage of this? Well, FSBP has made it easy for you. The easiest way is you have a dedicated link and a website that you can go to that will be shared with you all, I'm sure, after this presentation. But from there, you can access all levels of support. You can do self-guided coaching, you can do group sessions, you can do one-to-one personal coaching, you can learn about your health risks, you can connect with others with similar health experiences or challenges, and you can track activities. You could sync a wearable device, your Fitbit or your Apple Watch or whatever you may have, and follow your own progress and do all the things that you need to do to earn the incentives that you learned about earlier. And all of that can be done through that one digital point of access. So the other part of ActiveHealth, beyond sort of the whole person piece, is our focus on intelligent technology. And let me speak to you a little bit about that. And Drew, we can go to the next slide. It's important to know that the lifestyle and condition coaching program I was talking about is really supported by the latest technology and by some very sophisticated healthcare analytics, as well as security. And I know that's important to everyone, that your health information, your personally identifiable information, and your personal health information are kept secure. We use data to understand every individual's health. We build what we call longitudinal records of someone's health, so we can see what's happened to them along a period of time, over a year or years, to understand how they're progressing or not progressing with a particular condition. We use that information to find the opportunities to help improve health and to prioritize those opportunities. So if someone just throws 5 things at you to do, sometimes it's like, well, where do I start? We make it easy, and we present you health actions, and we say, here's the first health action you should take, here's the next health action you should take, here's the next health action you can take. So we do the prioritization for you and make the key connections that help support those health improvements. Our technology sort of allows you to have a familiar digital experience on a mobile device or on a computer. As I said, it provides some actionable things you can do in a timely fashion. Those things are personalized. So if there are 5 people in your group of people you work with, and all 5 have diabetes, and all 5 are part of this program, none of them will have the same set of recommendations or experiences from us, because we know each person is an individual, and no 2 people, even with the same conditions, are alike. Some have some things they should focus on, and some have others. And guiding you all along that journey is our job. And a little bit of information for you just about data and why it's important and why it's beneficial. I know some people are a little concerned about their health information, but what data does for us and allows us to do for you is to personalize the experience, to know what makes you different from your neighbor or your coworker, to provide a customized experience when you log into the digital platform or when you're working with a coach, so that we're not talking to you about something that's irrelevant to you, but rather finding something that is really relevant and actionable at this moment in time that can help you. It avoids us leaving people behind. We know that just because people have an insurance or a benefit plan doesn't mean everybody's taking advantage of it in the same way. It doesn't mean that people don't have different challenges with accessing those benefits. And you all have a very rich benefit plan, as clearly outlined today. But you'll find there are people who, even with the best of benefits, sometimes have challenges getting their medicines or getting the right foods or getting to the doctor. And the personalization of data allows us to not leave those people behind, to identify those risks, those social risks, and try to find supports to get people through them. And importantly, as I said, all of this is done at the highest level of security and protection for your personally identifiable information and for your personal health information. Another thing ActiveHealth really focuses on is what we call generational health. And I think this should be really important to all of us, and certainly to you all as part of your benefits. On the next slide, we talk about our primary goal. And one of our primary goals in working with populations is to help every individual achieve their best health, whatever their best health is for them. And that, again, is going to be different for everybody. But when we're working with you, we're not just looking at a specific issue, but we're looking at your sort of what else is going on. We're looking at the context of your life, and that means the people in it. And that means the environments that you're in and things that you choose to share with us about those challenges and benefits. because we know that all the lasting and impactful improvements we're trying to get you to make, all the behavior changes that will improve your health require a shift, and that shift has to be workable in your individual environment. So collectively, all of those shifts have to impact not just you, but your family, whether that's genetically your family or your chosen family or your community, and the people who inhabit the areas around you. So for us, building what we call generational health really depends on you making transformative health changes, but changes that take hold, right? Changes that get passed down through your families, to family members. And an example of this is sort of think about how you learned to like foods as children, or what your go-to snacks might have been. Like, did your parents keep a bowl of apples and oranges on the kitchen counter, or did they keep Snickers and ring dings on the counter, right? You sort of learn to like what's in your environment. You learn to like what your parents liked or made available to you. How do you and your family choose to interact with each other? When you call your sister and say, let's get together, is it to watch a movie and eat popcorn and snacks, or is it to walk around the track at the local high school? Or when you get together as a family for holidays, is the goal how much can we eat around the Thanksgiving table, or is it let's have the annual challenge family football game or tag football, or let's do a walk or run a 5K as a family? It's normalizing those kinds of healthy choices, whatever they may be and however they fit into your lives, that make those impacts that are lasting and that get passed along to the generations that follow. So the work we do with you today, the work that you do, how you impact the communities that surround you affects not just your health, it affects the health of those around you, and really provides an opportunity to pass along generational health. And as you all focus on your benefits, whether they're financial or whatever the health plan and the set of benefits that the FSBP is making available to you, right? You're focusing on those parts of your life, and particularly when people look at their financial stuff and they think about their retirement or all of those kinds of benefits, and they think about what am I passing along? We're asking you to think about, am I passing health along as part of that? And I think, as you walk along this journey, sometimes that can be a powerful motivator to people as they improve their health. So the next slide, I'll kind of stop there and see if you have any questions, but I want to leave you with this thought that encapsulates some of the key points I'm really hoping you'll take away. First, if you weren't before, perhaps now you're really convinced that there is an essential connection between your physical health and mental well-being. And you now really understand how chronic conditions like hypertension or heart disease and others can really significantly impact mental health, and vice versa, how the mental well-being is key to your physical health. The second thing I want you to kind of take away is that you now have at your disposal a resource to help you manage your whole health. One that can provide you guidance, can give you support, and can personalize a path for you toward you getting to your best health and to reaching the health goals that you choose for yourself. And the last thing I'll say is that ActiveHealth and your lifestyle condition coaching program are here as part of your benefits and are your supports to finding whole person health and well-being. And I invite you to explore what's available to you. In the very same way you're focused on those other benefits, start focusing on your generational wealth. We think of the opportunity to engage you, the way to get there. And so I'll stop there and ask if there are any questions. I'll hand it back to Kyle. Thanks for the opportunity to talk to you all today.
Great. Thank you, Dr. Rubens. I actually have a personal question, but before I get to that, I just want to remind everybody attending you can use the Q&A feature to submit any questions you have for Dr. Rubens. But Dr. Rubens, I went over your bio at the beginning and noted that your background is in emergency medicine, and now you're focused on population health. Is there a reason that maybe you've sort of made that shift, or are there things that you saw in your career in the emergency room that led you to start focusing more on the population side and management?
Well, that's a great question, Kyle. When you think of emergency medicine in the broadest sense, right, it is population health. We have to know a lot of stuff about a lot of stuff, right? So when you come in with a cardiovascular emergency or a neurologic emergency or a pediatric emergency, we have to know enough to be able to manage those things. And so that's population in a broad sense, right? And also you start realizing that there are ways you could back all of that up. Sometimes in the emergency department, you see the and the tail end of all of the cascade of events that got somebody to the point where they had to have their foot amputated for diabetes, right? And you think, well, if I'd gotten them upstream, we would never have gotten here, right? If I had better managed their hypertension, they never would have developed atherosclerosis, they never would have had that heart attack, or they never would have had the kidney disease. And so the opportunity came along for me to think about how could I use the skills that I had and the knowledge that I've gained to impact populations in a different way. And emergency medicine is a sort of a one-on-one. And what I'm doing now is kind of a one-on-many. And so it's that sort of view of things. It said to me, this is a good way to use talent in a new way. So it worked out.
No, I appreciate it. I realize, we've talked several times over the last several months, and I hadn't asked that question, and I appreciate the answer and the approach of the one-on-many now. And I know you have a hard stop in a few minutes, but I did want to ask and go back to something you said, that you have a multidisciplinary team, and that many of the coaches on the team have multiple sort of certifications and training in multiple ways. If someone presents with maybe a chronic condition, let's say they have high blood pressure, but that progresses to other issues, they develop diabetes as well, perhaps they're facing surgery or recovery from surgery, will they stay with the same coach? Will there be multiple coaches who are helping them? What is the approach that you take in a situation like that?
So great question. Our general approach is what we call a one nurse, one coach model, so that once you establish a relationship, and a relationship to us is a very significant thing because it involves trust, sharing personal information, developing a rapport, and only from that basis are we able to help people along these journeys. So we really sort of have the philosophy of a one-to-one model. When there are complicating factors or things happen along someone's health journey that require other expertise, we do a couple of things. We certainly have an internal consultative model. So if a nurse is working with you, Kyle, and they need some information to help you better manage your medicines, let's say you came out of the hospital and went from having 5 medicines to 17, which does happen to people, she will consult with the pharmacist, and they'll figure out what the best plan is, and together they'll work together. If we have someone who's working with you on diabetes, let's say, and there are mental well-being issues that have come up, we have behavioral health specialists that will consult in the process as well. But we try as much as possible to keep people sort of one-on-one, so that they develop, and they keep those interpersonal relationships, because that is really key to the success of the model.
Excellent. And I just before you go, you talked a lot about technology, and I think that is one of the features that the lifestyle and condition coaching program offers that some of our previous programs didn't. It's it's multifaceted. We're bringing a lot of data into it. There are ways that members can interact on their mobile devices every day. If somebody is maybe a little lower tech, can they still take advantage of this program telephonically or anything like that?
Absolutely, absolutely. You can. There's a telephone way in all the time. So yes, that they can certainly do that. They can even our nurses on the phone with them will even walk them through setting up things on their phone or on their tablet or on their computer, so they can do both. There are people who do both. There are people who only want to do the digital piece. There are people who only want to do the telephonic piece, and we are open to doing whatever mode works best for the members.
Well, Dr. Rubens, to you and your team, thank you very much for assisting us in meeting our members where they are, not only just with today's meeting, but also with the broader LCC program. I greatly appreciate you joining us today to share a lot of information about whole person wellness, mind, body, and spirit, as well as the details of this program. And I look forward to more of our members taking advantage of it and speaking with you again in the future.
Very happy to do it. Thanks for having me, Kyle. And I encourage everyone to make the connection. We're here to help.
Thank you so much. And thank you once again to Dr. Rubens for sharing all that information with us. And we've had some requests about how to access this, and I will be answering those questions in the Q&A feature. I will also encourage, there's the word, encourage all of our members to visit our website. I know I'm pushing that a lot, but there's some great information there. And we have organized all of our wellness programs into a single site. You can find the information there. You can find information about the incentive program. So that's afspa.org/FSBP/wellness-programs. or you can just go to the site and use the search feature at the top and look for wellness programs. So please take a look at that. And some of you have also asked about how to access information about your incentives that you've earned, how they've been paid out, and more like that. We do have that information. It's actually inside the Aetna Secure Member website, which again is linked from various places on our website. And we're actually going to have a demo of that site in just a minute. But before we get to that demo, we're going to go through the Express Scripts demo. And I'm happy to share this with you, to walk you through the Express Scripts site, including, I'm so glad to say, how to order over-the-counter COVID-19 tests directly from Express Scripts. And my friend and colleague, Cynthia J. Rathjen, is going to walk us through that, followed by a demonstration of the Aetna Secure Member website by our Senior Account Manager, Britt Pirates, who some of you may have met on her travels around the world on behalf of the plan. So please stick in there with us. We've got a good bit, over 10 minutes of video demonstrations coming back. Please keep the questions coming, and I'll be back afterward with some live questions and answers.
Hello, I'm Cynthia Rathjen, a training consultant in our Strategic Systems demo team. I've been with Express Scripts for a little over 2 years, but bring with me 20 years industry experience and 5 years in digital engagement. I'm pleased to provide an introduction of our member website and mobile app today. Express Scripts invests in digital engagement to empower you to learn, track, and manage prescriptions wherever and whenever. Our market-leading mobile app is currently rated 4.8 stars in both the Apple App Store and Google Play. I'll be using a static demo today, and please keep in mind that the demonstration is not plan specific. But in production, both the member website and the mobile app deliver a dynamic, personalized, plan-specific experience to you. Logging in or clicking on a single sign-on link, you're going to be taken directly to what we call the dashboard. We can think of this layout as a one-stop shop experience serving up the most popular online actions: refills, order status, and make a payment. It's designed in a tile format that eliminates the need to scroll or navigate away from the page. Actionable items will appear on the tiles, such as past due refill or order status, which empowers you to take the needed actions quickly and easily. On the bottom right-hand side of the page, you'll find the link to order at-home COVID-19 tests that are delivered directly to your home. Your benefit plan may cover up to 8 at-home COVID-19 tests every 30 days per member. This means you'll pay zero copay for covered tests. Simply complete and submit the online form. Refilling a home delivery prescription is easy. The number of prescriptions appear directly on the tile. And by clicking the tile, it displays a list of prescriptions in an over panel. Simply click Add to Cart, and your order will be added to the checkout cart that remains at the top of the page. Click the cart to complete your order. Checkout can be completed in as few as 2 clicks or 2 taps from the mobile app. To make it easier to pay for your prescriptions, you can choose to pay in 3 installments by choosing the extended payment option during checkout. And signing up for automatic refills makes it easy to keep your medications on hand. You'll be notified when an order is in process, and you can even change the delivery date online if you need to. Once the refill is in process, you can come and check for the status of your order. You'll receive notifications based on your communication preferences that you've set up online, and that can be either by phone, email, or text messaging. The real-time status of your order can be found here on the dashboard with details available by clicking the tile. The main navigation across the top remains consistent on every page, and this navigation bar provides additional functionality that's not displayed on the dashboard. Use price of medication to answer questions like, is my prescription covered? Is there a covered alternative for my medication? And what is the cost of my medication? It's easy to compare brand to generic, 30 to 90 day supplies, as well as home delivery to local retail pharmacies. Find a pharmacy can be used if you're looking for a local and network pharmacy. And prior authorization status page will give you visibility to PAs that are in process or completed, including the expiration date. An alert will notify you if there's less than 60 days, giving you time to submit and request a renewal. Taking a look at our mobile app that is available from both the Apple App Store and Google Play. If you haven't already, I do encourage you to download our app, and it's easy to find it where you usually download your applications. Entering using either your username and password or biometric authentication like your fingerprint, you'll be taken directly to the mobile app dashboard. You'll notice immediately that it looks very similar to the member website dashboard we just looked at. And this makes it easy to find what you're looking for, no matter which you're in. You can refill a prescription, check on your real-time order status, pay a bill, or set up dose reminders to help you keep track of taking your medication each day. Other features are available by clicking the bottom. And these are very convenient to have in your pocket and on the go, like using Find a Pharmacy while you're at a doctor's visit, pricing a medication, and being able to contact us. Both ExpressScripts.com and the Express Scripts mobile app make it easy to manage your medication whenever and wherever, when it's convenient for you, from home or on the go, taking the stress out of keeping up with your prescriptions. Thank you.
Good afternoon, everyone, and thank you for the opportunity to be here with you today. My name is Britt Pirates. I'm the Senior Account Manager at Aetna that works on the Foreign Service Benefit Plan, and I've worked with the AFSPA team for over 13 years. Today, I'm going to be doing a demo of our Aetna Secure Member Portal. So let's get started. Once you log on to AFSPA Secure Member Portal, you can access Aetna's Secure Member website through single sign-on capabilities. When you access the Aetna Secure Member Portal, you'll be directed to this homepage. On the homepage, you have a lot of information right at your fingertips. You can look at your deductibles, out-of-pocket expenses, any type of claim spending, benefits. If you need to find care, we have resources on there for you to find care, and also additional resources for health and wellness and other support that you may need on your health journey. On the home page, we have a coronavirus resource site. We also have a plan overview that gives access about your medical coverage, how much you've met towards your in-network deductible and your out-of-pocket maximum. You also have access to view your ID card by clicking the link. It'll give you your WID number if you need it, or if you have lost your ID card or need to request another one for another family member, you can just click on this link right here to request a new ID card. Also on this page, you can look at different spending details. We have, as I said, the Coronavirus Resource Center. We have your Foreign Service Benefit Plan forms, information about well-being and mental health support, as well as cancer support right here on the home page that you can click to. If you want to know your benefits for a certain medical procedure, you can go to the Benefits tab. We have your office visits, routine services, overnight hospital stay. If for some reason you were to go inpatient at an in-network facility and you want to know how much you're going to owe out of pocket, you can look at this inpatient tab. So this is just a good resource if you want to know your benefits for different procedures that you can have for your health care. Also, if you need to find care, if you're looking for something a little more in depth, or you have a specific medical condition that you want something outside the minute clinic, we have dermatologists that you can look at. You also, if you want to, find a primary care provider, you can also find hospitals. You can also look by services or procedures. So if you needed a colonoscopy, then it's a preventative, it's time for you to have one. You can click on colonoscopy, and it'll find facilities in your area that perform preventative colonoscopies. So just a couple different ways for you to search and find care, searching by provider, searching by procedure type. We also have a health and wellness tab to provide additional wellness tools for you. We have what we call Discover a Healthier You. This just it helps you improve your health and well-being by setting health goals for yourself. We have the Stay Healthy, which is access to your health risk assessment where you can earn that wellness incentive funds. You also have access to your health record where you can update your immunization information about procedures, conditions, and treatments. If you find out you're pregnant, we have information about our maternity support center that you can enroll in. A case manager will contact you once you're enrolled. We also have information about other different programs that we offer. The Aetna Back and Joint Care Program is previously known as Hinge Health to address chronic back, knee, hip, and neck, shoulder pain. You can click on that to learn more information on that. Genetic health counseling. We have a telemedicine provider for that through Informed DNA that you access through this link. Different condition management programs. We also have our HealthWise knowledge database that has information about everyday health and wellness. It's an online resource that you have access to. And then we also have the preventative health schedule. And we also have health and wellness discounts, at-home products, blood pressure monitors, different activity trackers. You also have access to natural products and services, such as discounts on acupuncture, chiropractic, massage, and nutrition. Fitness, we give you discounts on gym memberships and virtual fitness programs, workout apparel, different apps, and other LASIK surgery, weight management, just a lot of discount programs that you can take advantage of as being a Foreign Service Benefit Plan member through the Aetna Secure Member Portal. And then one of the main things that members like to use this portal for is their claims and spending. They want to monitor their claims, different providers, what the plan paid, what they owe, especially to match up when they're getting bills from their providers. So it'll bring up all your list of claims for your family. You can go in here and click and determine who you want to see, who you want to see claims for. It gives you a date range. Once you find the claim that you would like to look at, you can just click on this arrow. It'll give you a breakdown of how much was billed, what the plan paid, the plan discount, and what your total liability is. And that's where you'd match that to your explanation of benefits. It also tells you the types of services that were billed on that claim. If you want to look at your explanation of benefits, you just click that link. It'll pull it up. You can just click on that View Explanation of Benefits tab. And then there would be your statement. Tell you what you owe the provider, how much you saved. It'll also go ahead and tell you your family in-network and out-of-network deductibles, and if they've been met. It'll give you a summary, the different codes that were billed, the discounts, and any remark codes that are applied to your claim can be found at the end of the explanation of benefits. But that's mainly what everybody uses this portal for. Like I said, you have a lot of resources at your fingertips. If you haven't registered, I encourage you to register so you can take advantage of these resources. Just let us know if you have any questions and we'll be happy to assist you about the Aetna Secure Member Portal. Thank you and have a great day.
Great. And thanks to our partners at Express Scripts and Aetna for providing those demos. I will say that the blurriness sort of at the end of Britt's presentation there, where she was sharing the explanation of benefits, was intentional to make the things happen. She actually shared her personal account at times, and we didn't want to share some of the information that's on there. So hopefully that came through. If not, we can point you to some information on our website where we've got details about how to read the EOB. So I hope that you all found those demonstrations helpful. They will be posted separately on our YouTube page, so you don't have to scroll through this recording once it's available to find it. You can go there, and actually we'll have a bit more detail on that on Britt's actually about some additional features and more step-by-step. So we are actually moving toward the end of our program, but we have a little more time than we anticipated for some live Q&A. I appreciate everybody who's been submitting questions. I see now 39 questions we've received from you all. Thank you very much. And we have some that we can ask Paula since she's here. We actually have some questions that you haven't seen in the Q&A. So I'll ask Paula to join us on screen. Paul, we got some fantastic questions that you've likely seen in the Q&A box throughout today's session. We also got some in advance. And I just wanted to run through some of these as we have time and ask you to share your expertise with us.
Sure, glad to.
Paula, I'm going to start with something that we haven't touched on that much, and that is long-term care insurance. We did have a question that went as, what are the key points to make sure a long-term care insurance policy has in it? What are the typical things to look out for in such a policy?
Okay, well, long-term care policies are relatively new. They were developed, as you know, in the late 80s. We started offering it in 1990. We no longer offer a specific long-term care policy, but we do offer guidance and expert advice on that because there are so many different policies out there, right? And the latest facts are that 70% of us who turn age 65 are going to need some type of long-term care. So this is a really, really important benefit to have, type of coverage to have. Long-term care has evolved over the years, and we can go with the traditional types of long-term care policies. We can go to the hybrid policies, which include some life insurance, in a lesser case, annuities, but it's wrapped around the long-term care policy itself. But you have to ask yourself a couple of questions, and this is really important. This is why we actually have expert advice from people in the long-term care field to provide to our membership, because it is a very individual and personal decision. One is your overall financial condition. You really have to look at that. You've got to look at what your financial goals are, where you think you're going to end up retire, and what insurance option works best for you. Also consider your age at the time that you want to buy long-term care. I mean, I certainly would never recommend somebody in their 20s or 30s to get long-term care, right? Because that disposable income is probably better used by paying for something else. But I always recommend that you really kind of start looking at it in your 40s, and definitely have it in place by the time you're about 50, because that is when, once you're locked in, since it is a level premium in most cases, you are locked in. The older we get, the more expensive a new long-term care policy is. So you really need to plan accordingly for that. So there's a lot of options that are available. The daily benefit can be a monthly benefit or a whole pocket of money. And then you need to look at, once again, what your financial situation is and compare that to how much money you're going to need. I never recommend you trying to underwrite or have a long-term care policy that pays 100% of whatever the cost is. I mean, the average cost in a nursing home now is what, $86,000, $90,000 a year, right? That would be a very expensive long-term care policy to buy and to pay for every month. So, you look at how much money you have and then subsidize that with the long-term care policy. Make sure that it covers all the conditions. Make sure it's flexible in home care, maybe, as it is in nursing home care. Now, there are some long-term care policies out there that pay only for nursing home. That may or may not be what you need. So there are a lot of things to think about, and I could spend a whole hour, which I know we don't have. I would recommend that you go to our website and look at the options that we have available as far as long-term care advice from people who really know this business and that can really talk one-on-one with you and develop, once again, a plan that really fits your individual needs.
Thank you very much, Paula. And for those listening, you can go to afspa.org and you'll find long-term care consulting under the professional services tab. You can also go back into our podcast feed. We did actually spend an hour with one of our partners back in October, I believe it was, on this. So please check that out. It's fantastic information. Paula, can you tell us a little bit about we've gotten a lot of questions about the wellness programs we have. You went through a number of them today, not all of them. But is there a limit? Do we say members can only use a certain number? They can only use up to a certain amount or anything like that? Can members use any program that we're offering under Foreign Service Benefit Plan that may help them with whatever their needs are?
Yeah, this is a question because we offer a lot, right? And people may think that, well, if I'm taking advantage of one program, then that's the only one that I can have at this point in time. And I can assure you from personal experience that that is not the case. So I will give you an example of what I have gone through over the last year or so. And I have used many of these programs at the same time. Okay, for example, I'm part of the Livongo program. Right. I used Able To at the same time. And when I developed a serious health condition, which is fine now, but at the time it was kind of scary, I used the resources of Pinnacle Care all at the same time. So no, there isn't a limit. And you may need, like I did, many of these services that can help you through either a chronic or a serious acute condition. So I would say that there isn't a limit. Go ahead and use all of the resources that are available to you, including the coaching program, which I found to be really great because it was kind of like a step down and I could breathe a little by still having that coach there. So use us. That's what we're here for.
Excellent. And Paul, we did have a question. We've had several questions about Medicare Part A and Part B and so forth. And I want to address those for anybody who might be looking at posting a question. Paula referenced this and we do have it on our YouTube page as well as in our podcast feed. Paula did an 1.5 hour long webinar back in January. So I encourage you to go check those out. Just youtube.com, search for AFSPA Cares, and you'll find the video there, Medicare and the FEHB. So I want to direct people to that. Paul, we did have a question about the difference between telemedicine and telehealth. You referenced both earlier. Could you explain the difference between the two?
Sure can. So telemedicine is a feature that we have, a benefit that we have, that you can actually see, and I say see because it's via video or via phone call, a physician or provider that you have an established relationship with. Okay. And we would pay that just the same as we would if you walk through that provider's door. Telehealth is a different version. Telehealth is we have partners through Teladoc stateside and vHealth that you call a number or go on their website, and that it is a video call that you can have with the providers that work for Teladoc or work in connection with Teladoc or vHealth. Okay, it is, and that is paid for at 100%. All right. You do not have a ongoing relationship with that doctor, but you can go to them. Like, for example, you have a rash, you develop a rash. Well, what is it? Go to a telehealth visit. I've done that myself. Or my eye is red. There's something in my eye. Go to a telehealth visit. And the doctor will actually look at you. And in my case, they prescribe the prescription, and right off the bat, it took all of maybe 15 minutes. So that's the difference.
Thank you very much. I think there's something we try to draw a distinction of when we speak, as well as in our benefits brochure. All right, Paul, we had a submission early on about the role of coupons in prescription drugs, coupons as well as programs like GoodRx, which sort of aggregate those coupons and things like that. How do those work for our members?
Okay, so here's the thing. Yeah, coupons are they're not a new thing, and you can use your coupon at retail. You can go to GoodRx and use your coupon at retail. We don't or we can't prohibit that. In many cases, it may be better for you to do that or less expensive. Although we do have pretty deep discounts that we've negotiated on your prescriptions. I wrote an article a couple of years ago about the use of coupons, and I'm not saying they're bad, because I think that they are very, very helpful, but be aware that the reason the manufacturers offer this coupon is because it will save you money, absolutely. But if you look at it closely and you look at the commercials on the TV with this, it will say only available for those who have insurance. Okay, because while you're getting a discount, and that's all well and good, the manufacturer is still able to charge the health plan the full amount. So, and then once your coupon expires, then you're going to be charged that copayment. Now, coupons are usually offered for higher cost prescriptions. So eventually you're going to have to pay that higher copay. So beware of that, but they can be used at retail. Actually, we have through Express Scripts, in a lot of cases, Express Scripts has electronic coupons that they use automatically to lower your costs. And that is really almost transparent to the member, but we do use that as well. But if you have a coupon, use it at retail, fine with us. We don't stop it. We can't stop it, but beware, it's like buyer beware that it may come back and you'll have to pay that full copay amount once you get used to that medicine. And at your next fill, where that coupon doesn't apply any longer, you might get a surprise that you may not like.
Excellent. And Paula, thank you very much. I think that takes us to the end of our Q&A time.
Oh, wow.
Yep.
Okay.
So we've got, I'm still fielding some questions in the Q&A by text. So I want to encourage members and other attendees to continue sending those. But for now, Paula, thank you very much for sharing your knowledge and expertise with us today. And I do want to get to that special surprise that I promised at the beginning. Before I do, I just want to mention that the webinar recording will be emailed within 2 weeks of today. We're going to optimize it, make a few adjustments here and then. But as I mentioned also at the beginning, you can win a surprise pack from AFSPA by, once you receive that link to the recording, going to our YouTube page, subscribing, liking, commenting on the recording. And after today, please look for 2 emails from us. One will be a follow-up survey on today's event. We do use this to make things better for next year. And the other will be a separate email providing you the member portal link and some more information about how to use that new member portal that is right now is optimized for mobile. And I think without any further ado, we are ready for that special surprise, our partner and wellness programs. Drew? Fantastic. So that was a video we put together about just a sampling of some of the programs we offer to you, some of which Paula and Dr. Rubens talked about today. I encourage you to go to AFSPA.org, check out the new website, explore it, find programs that will work for you and for what your needs are. Thank you so much for attending today. As I mentioned before, please complete the post survey and look for those emails from us. If you had a question you didn't feel comfortable asking today, or some of you I encourage to follow up with us, you can do so by emailing outreach@afspa.org. We will field those questions as we're able and likely send them to colleagues who are best qualified to answer them and follow up with you. We beg your patience. It may take us a few days to get the response, but it will be forthcoming. I'm just going to check my final notes here and make sure that I'm not missing anything that we wanted to cover today. I want to encourage you, look for more events from us in the future. We plan to, throughout this year, as we did last year, offer more online events, more opportunities to engage with us, AFSPA staff members, as well as with our partners. I'll also encourage you to go to our YouTube page, because all of those webinars we've had are available for you to view, to go back and review if you attended them previously. Follow us on social media for the latest information, our blogs, our podcasts, our YouTube videos, and special announcements around new programs or changing coverage or new options under COVID testing and treatment. We announce those there on Facebook, on LinkedIn, on Instagram, and on YouTube. So please check those out. Please follow us there. And thank you once again for your loyalty as a member and for joining us today.